Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and KUAR-FM 89.
Hello again, everyone. Thanks very much for joining us. It is mid-May, and if the coronavirus curve may be flattening in Arkansas, the danger persists, especially in what we have learned to call congregate settings, churches and especially prisons, and in communities of color and among the low income. When the outbreak reached Arkansas, it initially presented pretty much along the state's existing ethnic demographic. To the surprise of no one in medicine, that changed. While African Americans make up barely 16% of Arkansas's population, their share of the state's confirmed COVID-19 cases is more than double that. Well, to tackle that subject and other aspects of the virus in Arkansas, we are joined remotely by Dr. Susan Ward Jones, the CEO of the East Arkansas Family Health Center at West Memphis, Dr. Pebbles Fagan, director of the UAMS Department of Health, Behavior, and Education, and also from UAMS, Dr. Brian Gittens, who's Vice Chancellor for Diversity and Inclusion. Dr. Jones, let me go first to you because you are in Crittenden County over there on River's Edge, as it were. You are kind of on the edge. You're not just Crittenden County, but your part of the state includes several of the hot spots. Does any of this demographic data come as a surprise to you?
No, it does not come as a surprise to me. I've been practicing in the West Memphis area for some 23 years, and I think that this pandemic is just putting a national spotlight on just social inequities that have been tied to race, class, and access to health care. So, of course, this is no surprise to me.
Earlier today, you were telling me, Dr. Jones, that you have seen more than one patient, to put it mildly, that has tested positive. What about their outcome? What about their overall state of health when they do present to you?
Well, we're in a community health center, and typically we see those that are underserved, uninsured, and those that have Medicare and Medicaid, and of course a lot of comorbidities. So many of our patients have the comorbidities of hypertension, COPD, asthma, coronary artery disease, and of course obesity that lends itself to complications if they contract COVID-19. So we've had a few deaths in those that have contracted those that we have, diagnosed. And then also the other ones that a fair number have had to be hospitalized to make sure that they're okay. So we've had about probably 50 to 60 patients that we've diagnosed or, with the COVID-19 as well.
Walk us through it, Dr. Jones, if you would. A patient presents in your office with all the symptoms. Soon enough, the test is conclusive. How much more difficult is it for you as a physician and for the clinical community as a whole to address the virus when an individual, man or woman, has hypertension, has diabetes?
Well, I will say for us, we're at a community health center, so we have a few number of resources, and of course we've changed our whole office setting in terms of getting those folks in, and we're doing more drive-through testing. But we've used a lot of telehealth, particularly those that are diagnosed and not necessarily needing to go to the hospital. But we use telehealth to make sure that we can check on them and make sure that they're okay, and make sure they have pulse oximeters at home to make sure if they do get in trouble, we can readily get them, to the hospital to make sure that they're taken care of.
Dr. Fagan, as a practitioner and a professor and a scholar, as it were, of adverse behaviors, let me put it that way, this can't be a terribly unusual scenario, or maybe an unusual scenario, but this is to be expected, is it not?
Yes, it is. I mean, we know that many populations, such as communities of color and people who live in poverty, often experience multiple disparities. So it shouldn't be a surprise to us that, with this particular pandemic, that we would see similar patterns. I mean, the challenge that we face in our state is that 17% of the people in the state live in poverty, but among African Americans, about 30% of people live in poverty. And that is more than twice the rate that you see among whites in the states, who about 13% of them live in poverty. So when you think about factors such as what we call social determinants of health, things such as poverty, being medically underserved, being geographically isolated, having issues with food security, those things combined with other risk factors such as smoking and obesity, and these populations put them at a greater risk for being susceptible to COVID and not having adequate access to health care, because they didn't have great access to health care before the pandemic. Now you add the pandemic on top of that, and tools that we have to reach these populations, such as our digital health technology, are extremely helpful. But these populations do not often have access to broadband. They may not have a smartphone, and they may not have the minutes to put on their phones to accommodate appointments that they need with their providers if they were to get sick, and if to just manage their current comorbid conditions that they have. So we shouldn't see this as a surprise, but it is an unfortunate situation that we're facing.
Well, is more care available? I mean, we're several years now into the Affordable Care Act, which may have taken at least some of the financial edge off care. Is there more care available, and poor people simply can't access it? Or dwell on that for a second, if you would.
Yeah, I mean, we certainly, with the Affordable Care Act, we were certainly able to get more people signed up on Medicaid. We did the Medicaid expansion in our state. You may also recall that we went through a time period where there were people, over 18,000 people, who were actually kicked off of Medicaid, and we've been trying over the last year to get those people back on. And so we still have some challenges that we face, even with people taking advantage of the Affordable Care Act. Because think about it, if you're poor, and you don't have transportation, how do you get to a health care facility? You're bearing the additional burden of the cost of getting there. And if you're living in rural counties, such as where Dr. Jones works, I mean, getting access to care is still difficult, even when you have health insurance. And so we still have many challenges that we have to overcome, even with the Medicaid expansion that we have in our state.
Dr. Gittens, let me go to you now, if I may. Any of this, I would assume much of this resonates with you.
Absolutely, absolutely. I think that this pandemic has really exacerbated a lot of the healthcare disparities. As you know, when we start talking about social determinants of health, socioeconomics are a huge part of that as well. When you consider that a lot of our minority populations work in these frontline jobs, these service sort of jobs that are very public facing, many of them don't have the privilege of working from home and teleworking like many of us do, and we're doing today, as a matter of fact. So there's so many factors associated with this disproportionate both mortality rate as well as positive infection rate due to persons of color.
What's the solution here? I mean, obviously it's not going to be one overnight, but where are the gaps that we, as the doctor indicated, Dr. Gittens indicated, well, I think all of you did, there are some pretty serious policy implications here, failures. Dr. Gittens, we'll begin with you.
Sure. I'm not sure if I have the answer. I'd be a very rich man if I had all the answers. But I think that a huge part of it is some of the work that we're already doing with regard to trying to improve access, trying to mitigate the barriers to access to quality care. I've been partnering with the Arkansas Medical and Dental Pharmacy Association, along with the Minority Health Commission, for outreach efforts, getting the word out in different languages. We've worked really hard at UAMS, as you may be aware, to get mobile testing units out. I understand that the Minority Health Commission and the Health Department is starting to get mobile testing units out as well, just trying to penetrate those areas that have been underserved. But it's tough because historically, as you may be aware, we also have people's just distrust of healthcare. And that's a tough one to overcome because there's some historical roots in that where people aren't getting healthcare, aren't going to the doctor until they're very, very sick. The acuity levels very, very high, and oftentimes it's too late to do anything about it. But I'll defer to the physicians on the panel to discuss that in further detail.
Yeah, well, Dr. Jones, you in particular have long argued for a more holistic, well, I don't want to say holistic, but certainly a multidisciplinary approach to minority health care.
I have, and I will say, representing Community Health Centers of Arkansas, we certainly do offer comprehensive care. Even at our West Memphis site, we have access to medical, dental, pharmacy, ophthalmology, case management, transportation, and to really try and combat all of those issues that face folks in trying to access health care, particularly as it relates to transportation. We saw a need, and we have transportation, and it is utilized heavily. But I think as a public health, basically physician, that my role is to make sure that people receive, just clear, concise, frequent education, which I think is the key, constant education. I spend much of my time in office visits now educating about COVID-19, but also COVID-19 apparently is going to be here, and we cannot, look aside from all the other comorbidities, the hypertension, the diabetes, the CHF, and the lung cancer and the colon cancer. We cannot take our eye off that. Then also, I think we have to make sure that we are connected with the faith-based sector, also with businesses and education and transportation. It is my job to link people to services, to comprehensive services, to make sure that they have access to their medication, they can get specialty care, and to make sure that we're culturally competent to understand the plight of the minority population, and also make sure that we use evidence-based guidelines in everything that we do.
We have talked thus far in the broadcast anyway about the delivery of health care, access to health care, and framed it more or less through the communities of people of color. But it's really not, it's not restricted to that by any means. We're talking about income, social status, socioeconomic status, I should say, as well. Dr. Fagan?
Yeah, absolutely. And then, Dr. Gittens pointed something out earlier, which is occupational class. Because when we're talking about people who live in poverty and people who have low incomes, we're also talking about our wage workers. And people do not have flex time like some of us do to work at home, or if they miss work, they don't get paid for that time. So when we're talking about different classes of people, such as those people who I call working on our front lines, those people who are working in grocery stores and at Walmart and working in the factories, we have to have solutions that help to bring them back to work safely. We understand that everybody has to have income, but we want people to get back to work safely. So one solution is that we really need public health infrastructure, not just within our healthcare systems, but within our workplaces as well, so that when people go back to work, that those workplaces are providing safe social distancing so that those workers are not getting sick again, being sent back home, and then they're missing out on income and then spreading this contagious virus to other people in their homes. And so when we talk about public health infrastructure, it expands beyond the healthcare system into the workplaces of our populations that are disproportionately suffering from exposure to the coronavirus.
Well, to follow up on that, Dr. Fagan, that's going to be exceptionally difficult in some occupations, some industries, some workplaces, is it not?
It is, but what I'm doing right now, even for my own workspace, I have put together a plan of how we could social distance and how we also think about alternate shift work that would keep people safe. And so I think what needs to happen is that you need a group of people who are going to sit down and come up with some creative ideas. That's what a lot of these places are doing. But it's incumbent upon us to do it if we want to make sure that this economy keeps thriving and that the health of our workers continue to thrive as well.
Let me, to any or all of our three doctors here, we talked a second ago about, we've been talking about failures of the policy establishment. Now, not to take up necessarily for the policy establishment or play devil's advocate, but individual responsibility comes into play here as well. I mean, it has been we're now into the 6th month basically of this pandemic, and a lot of people are not doing what the medical community tells them they very much need to be doing, whether it's mask, washing hands. Go ahead, doctor.
No, I think that's a great point, and earlier was mentioned about cultural competency with regard to messaging and with regard to communications and the like. I think that leveraging our faith-based leaders, as well as other influencers in the community, to ensure that the messaging is getting to people in a way that they understand, a way that connects to them, and from sources that they believe in. Because again, if we accept the premise that there is a gap with regard to trust between sort of official healthcare establishments, and some of them at least, then the messaging is not going to be received the same way as somebody who is on the ground in the community. So it definitely takes that community partnership and people working together to get the right messaging in front of people so that they can comply with the various standards that are given by the Arkansas Department of Health, as well as their medical professionals.
Again, to any of the three doctors, we are obviously, Governor Hutchinson himself has acknowledged there is pressure from commercial interests to get going, to open up the economy again. Do you fear that we are moving too quickly to do so? Dr. Jones, we'll begin with you.
Well, I understand the need to reopen and get back to some sense of normalcy and the economic issues that are at hand. But I think that if people are not adhering to guidelines, that perhaps we're going to have a bigger problem later on. I think the most angst that I have is that age group of 18 to say 30 that just don't believe that they can get this, or particularly in the minority population, were told somewhere along the line that they could not contract this virus. And I think it has to be constant education. There's a way to go back in, but we have to be, individually responsible to make sure that we're doing what we can in terms of social distancing, hand washing, face mask, and all those things. And I think the key is the trusted resources that people can turn to, that they can, believe in.
Dr. Fagan, in fact, if I'm reading the demographic data correctly, much of the focus is on those 65 or 70 and older. But Arkansas would appear to have a substantial number of individuals, as Dr. Jones indicated, in the age range of, say, 20, 25 to 40, 45.
Yeah, absolutely. And I think one of the things we have to make sure we do is be clear about our messaging. I mean, I think we have confused our public audiences quite a bit. First, we told them not to wear masks. Now we're telling everybody to put on a mask. And it's important that we do that because we protect each other when everyone has on the mask. But when you talk about personal responsibility, our confusing messages make people somewhat skeptical. With regard to personal responsibility, also, we have to make sure that everyone has access to a mask. And so, you know, we're telling people to make masks at home. That's important. But does everyone in the household have access to a mask? When people go back to work, do they have access to a mask and other personal protective gear that they need to thrive in the workplace? And our young people need to really understand that protecting themselves protects other people. And it's a tough battle for us because young adults already feel that they're invincible. And so we have to keep doing the messaging to those communities to help them understand this is a really serious thing.
Dr. Gittens.
Yeah, I think part of it, in addition to having access to the mask, is wearing them correctly. I can't count the number of times I've been to the grocery store or other retailers and there are masks on people's chins or not covering their noses and things like that. And as a former Marine, that's the type of thing that I look to leadership, in these cases, managers and general managers of these establishments, to ensure that the employees are protecting themselves as well as their customers as well. So I think there's some behavioral accountability sort of things that can be done by the community at large as well.
Well, Dr. Gittens, let me stay with you for just a second. There would appear to be, well, as one of the other our other guests indicated, there seems to be conflicting. There are conflicting messages from some of our commanders on this subject. Obviously, there's beginning to be a political pushback against the clinical advice that's being heard at the national level. Your thoughts on that, if I may ask?
Yeah, I think there's a tension, as was stated earlier, between opening the economy, us getting back to a sense of normalcy, and public safety. So I think that we have to continue to look at the science, continue to look at the models, continue to look at how this virus is transmitted, and guide our policy procedures based on that.
Well, Doctor, let me go to Dr. Fagan then. Many college campuses, anyway, are already planning to reopen for the fall semester. That's just a couple of 3 months away, really. And there's great pressure on to open public schools again. You have reservations about that?
Well, I think, again, we have to plan appropriately. And so do those college campuses have a plan in place for safe social distancing to deliver their education? And even in our school system, what is the plan that each of those school systems have in place to protect children from the harms of COVID? And so if there is a plan that protects the health of all people in those educational environments, then we should move forward with it. But we should not move forward just because we want to open things back up.
Dr. Jones.
Yeah, I agree that we have to be deliberate in what we do. I have a 19-year-old that attends college in New Orleans, and he's anxious to go back and was, mighty upset that he had to come home. But obviously in the hotspot there, I'm particularly concerned. But, we have to weigh the economics, but also move into that very carefully based on the, public, in terms of the advice from our experts that are looking at the numbers. And, we just have to come up with a plan. I'm interested when my son goes back, what's the plan for, re-entry into college? Do you test them, when all the students get there? Do you test them every week? Just kind of what the plan is. And I think everyone's scrambling, trying to figure out what that needs to look like.
Well, I would ask all three of our doctors. I'll refine the question just a little bit. There are obvious discontent at some high levels of government with clinical authorities such as Dr. Fauci, some of the others at CDC, other experts at CDC, and the other government health agencies. Do you despair at that? I'll start with Dr. Gittens.
Could you repeat the question for me?
Yeah, there's obviously some some of it's even caustic criticism. For example, Dr. Fauci, others at the CDC, and other government health planning agencies.
Yeah. And so I would say, like I said earlier, I think Dr. Fauci may have even said this, is that the The disease or the virus is going to determine the timeline when we get back to a real sense of normalcy. And I defer to that. I mean, I think that in terms of our being able to get back and open up the economy and get back to the life the way we know it, we'll have to have a plan. We have to be safe about it. We have to be smart about it, because literally lives are at stake.
Dr. Jones.
Yes, I would agree. I think we always have to rely upon our experts. Dr. Fauci, of course, is well known. I've followed him for many years, Dr. Birx, and, we just don't want to get back in society and have to revert back again, go back where we started. So I think, there's pressure, the economy, and, everyone's saying that the cure is worse than the disease. And I'm well aware of that, but we must be mandated by the numbers and the experts and move very cautiously.
We have about 30 seconds remaining, Dr. Fagan. I want you to have them.
Yeah, I'm a scientist, so I believe in allowing the science to inform the policies that we're making. And as this pandemic continues to evolve, I think we have to just make sure that we're taking the proper steps to protect our public. This is so critical as we move forward. We don't want to continue to make mistakes and sacrifice the health of our public because of that. I mean, particularly our vulnerable populations. We are a state with 17% of the people who are poor, and we are a state with a lot of wage workers. And, we want Arkansas to be healthy, and we want our citizens to thrive.
Dr. Ward Jones, Dr. Gittens, Dr. Fagan, thank you so much for being part of the broadcast. And good luck to all. We'll see you next week.
Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and KUAR-FM 89.